Welcome to Rock the World with Kay and Michelle. We explore stories of courage, resilience, and innovation, highlighting both the similarities and diverse experiences that unite us all.
Hi, and I'm Michelle. I'm creator of Movement Lesson, known for my modality to helping special children out of necessity to helping with my own children. Kay and I have joined forces, and our podcast today is on special needs, medical versus diagnosis, and understanding the differences.
Hi, I'm Kayla Ireland, founder of Kindly Neurodivergent with Kay. I am a 26-year-old cerebral palsy influencer here to rock the world. Currently, I'm a college student, avid horseback rider, office manager, communication assistant, co-author, and the host of 3 successful talk shows.
Yes, you are.
The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, someone's processing their thoughts, in addition to repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. I have found and learned about so many amazing people through social media. All of my podcasts are important to me. What about you, Michelle?
Oh gosh, I'm so fortunate that I was able to help my son, but I mean, I had no intentions of doing movement lesson, but the modality came out of what I learned to helping my son, and slowly it was like, there's some lady over here doing something. But what's really great about this and like doing the podcast, meeting you, so thanks to social media, thanks to YouTube, I can proudly say that I could probably go anywhere in the world and either know somebody, or if I needed help, somebody would know somebody. A lot of people go and do things, but they don't know who the people are. They might go see a mountain or a building, but they're not seeing the families, they're not seeing the people. And uh, that's really great. And so today's special, we really wanted to cover medical and diagnosis, but understanding the differences. We feel it's really important for all of us to understand the difference between medical-based special needs and diagnosis-based special needs, because there is a big difference and sometimes they kind of collide. I'm here because I have a child with special needs, diagnosis of autism, yet at the same time, I have a very medically complex child. And this created all of this being special needs. Many of our children are complex with diagnoses, but need medical supervision. Many of our children also start out with medical complexities, which also might turn into a diagnosis. And this is why this distinction matters for caregivers, parents, advocates.
Especially before we do other topics.
Right, right. This will probably accumulate into a bunch of topics. Kay and I were putting this together, and we just kept saying, "Okay, this has to go in the next podcast. This has to go in the next podcast." And you know, we are here, and you are here listening to us because we have wonderful children. We're not here to know about medical trauma or complexities, nor do the diagnosis. No one's having a baby for something to be wrong with them. And I I didn't know this could happen. And Kay is also living proof of this.
Why does this distinction matters for caregivers, parents, and advocates?
Um, it matters because you have to realize that when you're talking to a lot of people, let's say I'm talking to a professional, they have to understand I have to talk medical. When a parent talks developmental or diagnosis to a professional, that might not be why they're there, and they're looking for a medical reason why your child is gone through that. A lot of people feel that if there was no medical trauma during birth, then nothing should happen. There's so many reasons why. And like you, Kay, you went from medically complex to a diagnosis.
A neurologist diagnosed me with cerebral palsy. On my current neurologist reports it says, manifest by spasticity and superimposed dyskinesia and action dystonia, secondary to hypoxic ischemic encephalopathy as a newborn. In addition to epilepsy, both focal and without secondary generalization, now in remission on treatment. Associated kyphoscoliosis.
And a personal experience or stories related to the topics. Again, my son Graham got Haemophilus influenza type B, Hib, when he was 13 months old. This is the vaccine that we commonly give our children. And in this case, he didn't develop the titers, he developed the disease when he got vaccinated. So the infection immediately made his vestibular system inoperable with loss of muscle mass and vision. He has had 30 surgeries. Uh, it was too much for his cognitive and physical responses. His medical trauma then led to a diagnosis of autism, cortical visual impairment, autoimmune disc failure, and at the time, mental retardation. Please don't get upset with this diagnosis. This was my son's. It's now cognitive impairment because he's 22. It's changed through advocacy, like we're doing here, and people made things more neurodivergent. Yeah. Yep.
I exited the womb and into the world with the assistance of a vacuum as an unconscious, full-term baby. My pediatrician performed CPR to give me my first breath of air. An emergency transfer was initiated to another hospital better suited for my needs. I spent 12 days there in the NICU before my parents could finally bring me home.
That alone is a lot for parents. Just to interject quickly too, because when Kay was moved, most likely her mother had to wait until she could even leave the hospital after the birth. It's not at the same time. Most hospitals, when they're moving the babies, aren't moving the parents, because the parents don't need the medical needs. But anyway, medical-based special needs. It's a condition that arises due to procedures, complications, trauma, births, and it should have been an amazing experience.
There isn't a single, definitive statistic that precisely quantifies the increase in medically complex infants from 2000 to the present across all newborns and children, largely because medically complex isn't universally defined in a way that allows for consistent tracking over time. This is why we are here delivering our podcast. We are medically complex and no one is watching what is going on with the children. They are going after the diagnosis, but not watching the medical issues.
So when it becomes medical, most of us think that there isn't birth trauma, everything is going to be okay. To clarify this can occur at any point of life, birth complications, accidents, surgeries, infections. Like in my son's case, it was an infection. Let's say for cerebral palsy, it used to be a diagnosis of cerebral palsy was from birth trauma, but now it's from any brain injury during the lifetime. Infections, viruses, surgeries can go wrong, problem with childhood in many ways, and we just don't realize at any moment our lives can change. And two, the diagnosis can be there from genetics from utero.
My mother pushed for 2.5 hours.
Yep. But again, why it happened, the fight of why it happened is just not there. For example, my son's needs IVs for his immune system. He could die without them. He gets IVIG on a weekly basis. He will need this for the rest of his life. He is medically or was medically complex for years. He still is. I had pulmonology for his weak lungs, gastroenterology for his gastric, GI issues, ENT, ear, nose, and throat for his many head, ear, and sinus surgeries. He's at 18 to the head, dental included for his 6 mouth surgeries, immunology for his infectious disease. Initially, I'd gone through over 26 doctors for my son's care. So you would say he's medically complex, but again, he's not tracked.
I had seizures at birth and around 2 years of age. I had electroencephalograms which made me have to go sleep deprived with 22 electrodes glued to my scalp. To be sleep deprived as a child, I couldn't have more than 5 hours of sleep the night before. To give my neurologist the information needed to concoct a perfect cocktail, they need to record me falling asleep, sleeping, and waking up. They also flash lights to see if that causes me to seize. It sure isn't fun trying to get all the glue out of my hair afterwards. And unless I have seizure activity during the exam, it will come back normal. I just went 11 years without the seizure. We don't know why I had a breakthrough seizure in November 2022. My 20-minute EEG in April 2023 didn't give us any answers. Did you know that there are some diagnosis-based special needs? What are some of the issues that can cause a child to have a diagnosis and have special needs?
Special needs is really any child or person that needs somewhat form of assistance, and it could be medical, and it could be cognitive, it could be physical, to help them with their current situation. So it's a general term, but it can be due to autism, Down syndrome, rare genetics like muscular dystrophy, structural complications, even like hip dysplasia. Whereas cerebral palsy, let's say, is due to medical trauma, oxygen deprivation to the brain, prematurities, those kind of situations that then go into a diagnosis.
I was 1 year old when I was diagnosed. My condition went from a medical condition to a diagnosis.
Right. And even though you still have a medical condition, let's say for epilepsy, even though when you say you're in remission, it's still monitored, you're on medication for it, and those things go on. Um, but there are a lot of medically based special needs. Micropremies, premature births, NICU stays. Um, and I believe and I teach any newborn that went either longer than 2 days in the NICU and needs early intervention because of just the medical situation that they are in the NICU, and added to their level of birth trauma is the aftercare.
Every 6 months I see a neurologist.
Right. Um, and again, when you have birth trauma or oxygen deprivations, forceps, vacuums like you had, any baby, I believe, that has issues with your first breath during delivery or during the first 3 months of life will need intervention. They cannot oppose gravity in breath, which is the easiest thing to do. They can't oppose gravity in vertical milestones. And you are one of these people. Again, something that could have been caught, but I don't even, we're going to go into this in another podcast and just how early that your parents even got intervention for you or that kind of conversation going with your development.
It can be short or long-term challenges, recovery, or permanent impairment.
Absolutely. Babies and children that are prevented from development can't develop. So prolonged hospitalization can complicate their medical complications as well as a child diagnosed as risk for moderate to severe category very quickly, meaning that they just, again, you have IVs, you could be phototherapy, cannulation, intubation. There's a lot of things that could be happening that are actually preventing your newborn baby from going into development or movement.
Although I don't remember it, I'm living proof that I went into the NICU for life-saving actions to a full-grown adult. Imagine how real it is to be establishing adult medical care at the hospital where I spent time in the NICU. Let that sink in for a second.
No, it's something that most people, they say they can go years without seeing a doctor, and you haven't left.
Yeah.
Yeah, yeah.
Mm, mm.
We can't do that.
No, we can't do it. And a matter of fact, that's one of the things I have to do is make a whole bunch of doctor's appointments for Graham. Immunology now is his main thing, but we still do ear, nose, and throat and dental to do all of that.
Yeah.
It's just my cell phone is more medical than it is friends. So, but that's starting to change a little bit now that we're into adulthood, but it's not much better.
Mm.
Even the primary care.
Mm.
Right. Well, we just covered that before about, with parental guardianship. Please watch that podcast about too, how Kay and I were talking about just aging out and going into that next stage of life.
Yeah.
So, excuse me, we still need the doctors, we still need all of it, but now we're adults, but again, we're dealing with issues from the day of birth practically.
Yeah.
Let's talk about diagnosis-based special needs. Common neurodevelopmental conditions like autism, ADHD, Fragile X syndrome.
It is going on more and more, but there are many diagnoses that are genetic based that can cause, let's say, autism, uh, like Fragile X, charge. There's a couple of that are Prader-Willi, but there's also the I don't know autism. Autism is now becoming from 1 in 3,000, which used to be more genetic based, to more of a movement based. And so now it's down to 1 in 27. So there's reasons why as a child has autism does not yet have any connection to autism. So again, a lot of people are looking for, let's say, the medical component, but it's still a diagnosis that can be reckoned with, or things like ADHD need medicine to control them, even though it's a diagnosis. So again, is this a medical based diagnosis or it is a genetic based or combination thereof?
Or mislabeled cerebral palsy.
Absolutely. There are a few genetics, not many, but can cause spasticity. Most, and Kay will go into it, but most children with low tone are considered genetics, where high tone, it's considered cerebral palsy, where it's been an injury, but Rett syndrome, Fox gene 1 are some that are very high tone genetics.
Most children with low tone is an indication of a neuromuscular condition and is a genetic condition. At the same time, most signs of high tone are due to medical trauma. There are a few diagnoses that present with similarities to cerebral palsy. Let's talk about encouragement and actionable takeaways.
The biggest encouragement is for parents to know when to push for testing, therapy, or a specialist opinion. In my personal opinion, if you have a primary care physician that is now talking about medication, especially for an infant, younger child, It's not up to them to manage the care. It's up to them to coordinate the care. This is a hard jump for parents. They start grasping at straws, thinking that this is all medical, yet it's to be known a diagnosis. Genetics can take for years. My son's infection wasn't caught for 3 years. So there's a really and I didn't know. There were times my son was just dying. And we won't get into all of that, but he's almost died very several times, and I've tried to keep him alive this whole time. And yeah, it took 3 years to find his infection. When I tell people now that he had Haemophilus influenza for 3 years, they think I'm the one who's crazy because I didn't get help for him. And you just don't realize, and we have to give you all the encouragement in the world, folks. If you feel there is something wrong, act like there is. If you're wrong, that's what insurance is for, and
Yeah.
everything else is right. But please, if you start saying, I'm not sure if I should go to the hospital, if the word hospital, doctor, ER is coming out of your mouth, which is not normal, please go to the hospital. It's a hard time to say trust your gut, but this no one else is going to do it for your child. You have to be that. And we're here, there's many groups that can offer encouragement, but please don't be like so many, myself included. I wish I would have had done something sooner, and that continues.
For children, understanding how medical trauma and genetic conditions impact life. We are here to help you understand how medical trauma and genetic conditions impact life. A typical mindset shift, from special needs not equal to limitations to going to neurodivergent, needs to be introduced. I'm an example. Michelle's son is an example. The goal is quality of life and potential, not just diagnosis management, but also any medical trauma or threat.
It's really important. And also too, I want to take a moment to just for you to just be in awe of Kay. Um, as an encouragement. I know people see the limits when you're in you haven't slept and you're medically complex and you're in the NICU and there's surgeries and unanswered questions and so forth. The potential that we're here trying to show you, and this is why I wanted to do this with Kay, is so important because she's rocked it out. And that's why, again, Rock the World, I think really, satisfies all of that because it's important to know that there is a silver lining to all of this. But it's going to take a team, and the team starts with the family.
Be in awe of Michelle and Graham.
It's the same thing too. Again, our final thoughts and takeaway and to all of this, and we can really get into details, and we would love your feedback, but I had to save my son from a medical diagnosis and diagnoses. Um, uh, the worst thing that I ever gave to him was an autism diagnosis. Not that I couldn't handle it, but all of a sudden it's like, oh, he has a high white count. That's autism. I'm like, guys, he's sick. He has autism. I can deal with the autism. We need to make him better. Oh, he's not sick. You know, and and I didn't know that this was such a medical based situation. We needed a diagnosis for him to get services. So autism was fine. Some days it was a blur who I had to take care of. I had two boys. I was trying to convince the professionals that I needed immediate medical attention, not down the road medical attention. It had to take a priority, even thinking of therapies. And I tell parents this all the time, stabilize your child medically. That is so important. But we can't negate, again, that we had to work on development. So we hope this doesn't happen to you and your family, but maybe now or someday you will need this information. And this is why this podcast is so important, that we just get out enough information for you to get to the next level.
Life can change in a second. Just in the last 8 years, my family has had many unexpected changes with people who had heart attacks, strokes, surgeries and cancer. One of them was in the hospital for 43 days, I believe, due to complications after a surgery. My aunt was diagnosed with cancer in April 2021, received treatment and she was cancer-free 5 months later. Her diagnosis was in December 2023. They believed that she was platinum sensitive, so the same chemotherapy would work, but it didn't. The next chemotherapy had a 20% survival rate, so clinical trials were considered, but the first step was the 20% chemotherapy. She was too sick to even get the full 60-day treatment. Cancer kept spreading everywhere and had a lot of ER admissions. She couldn't hold her 9-month-old grandchildren or do art. She didn't want to give up. She passed away on July 3rd.
Yep, and also just to add to this, again, when you have family outside your family, and your primary care is your children, but you have to go outside, you still have to you be human. Your family is beyond your immediate family under your roof, and yeah, it can change quite quickly where you have to work with it all.
Please find us on every platform you see podcasts and videos. We will continue to bring our passion, knowledge, and unique perspectives to the next episode of Rock the World, coming soon.
I want you to know too, please get ready for our next podcast, which is what is a diagnosis. I know you think we covered it here. We really haven't, because again, a diagnosis is hard for parents. It's something they need to, but before we do it, please subscribe, share, give us more to do, post your questions and suggestions so we can help you out. Working out flow.